Hi everyone, I'm Danielle from Namaste Well, and I want to talk all about cervical dilation. Cervical dilation is a way that your care provider will monitor your progress of labor. It is only one of 6 ways that labor progresses, but it's often held with a high regard. And it's important to note for you to take heart and realize that this is the only one of 6 ways that your labor will progress, which we'll talk about in the next video. But I want to show you cervical dilation. This is a cervical dilation chart, and it means that your cervix is opening. It's closed throughout pregnancy and then begins to open. It may begin to open the last few weeks of pregnancy. You may have a vaginal exam and they may say, oh, she's 2 centimeters. I want you to note that this cervical dilation chart, based off of each person's exam, so it's a very subjective result when you're changing care providers and they're making an assessment. So what does this mean? Okay, so if you have a nurse that is ending her shift and she checks you into the hospital, he or she or they checks your cervix and is like, okay, they're 3 centimeters. Hours and hours go by and the new nurse on the shift checks you and says, oh, they're 2 centimeters. How could you go backwards? Or you find you haven't progressed at all for hours. You are not going backwards. It is just that it's very subjective because everyone has different size fingers and hands. So that's important to note, so please don't get easily discouraged with that. Another thing I would like to mention is that multiple vaginal exams during labor can be really uncomfortable and unnecessary because this is not the only way that your labor progresses. If it's something you don't want done, you have the right to say no to having these vaginal exam checks. And it's also a great idea to limit vaginal exam checks once your waters have broken because of the risk of infection. Okay, so we just talked about cervical dilation and how it's only one of 6 ways that your labor progresses. What are the other ways my labor progresses? Well, first, one of the ways that your labor progresses is that your cervix goes from feeling like the tip of your nose to your chin. So if you touch your nose, it's hard and kind of like rubbery feeling, and then the tip of your chin is really soft. So that is called cervical ripening. All it means is that your cervix is soft. Number 2 on the list, your cervix changes positions. So throughout pregnancy, our cervix is faced towards the backside of our body, so that's a posterior positioning, and it slowly makes its way into an anterior position, which is facing the front side of your body. Is cervical effacement. Effacement means that your cervix is thinning and shortening. If you need a visual for this, think about sucking on a mint. Slowly the mint gets thinner and shorter as you use it. So that's how your cervix progresses in labor as well. There is percentages of effacement. So your cervix is about 4 centimeters long, and as you get to 0% is not effaced at all. 50% is 2 centimeters interior effacement, and then 1 centimeter is approximately 80 to 90%. Already talked about cervical dilation, and this is the chart once again, just a little bit closer. Great visual. 10 centimeters, approximately 4 inches. So the cervical dilation, once again, is the cervix opening. Number 5, the baby tucks his chin or her chin in towards her chest, and this is called flexion, and the baby starts to come down through the birth canal and rotates. The baby's head also molds to the birth canal, the vaginal opening, in order to pass through the canal. Also important to note that if your baby is breech, that'll be a little bit different. Number 6 is stations in the pelvis. So your care provider may say the baby is at -4, so that's just floating above the pelvis. 0 station is that the baby is engaged, so head is down, ready to come out. As you progress from 0, there's plus numbers. +4 would be at the very bottom, resting on the perineum before baby exits and enters her world.